Hi friends, I just got off a call with an international pharmacist graduate earlier today, and they're interested in nuclear pharmacy and oncology research. And I was just there thinking that that is so cool. That's super cool. In fact, in Jamaica, there's only one nuclear pharmacist, right? And so it brought me back to the point of pharmacy being such a dynamic profession where we could go into academia, we could go into research. Pharmacists are in manufacturing, they're in distribution, pharmacists are in dispensing, they're counseling, they're now heading the general practitioner team. Like I've read about a pharmacist in the UK who has been asked by her colleagues to become the lead, the manager for the clinical team, the team of doctors, in terms of her medication and medical expertise. And I'm here thinking, like, why do so many of us put ourselves in boxes where we don't belong? And why we do not talk about what we do, and so people assume that pharmacists are pill counters, or they just believe that, oh, you just go to the counter and you talk to the pharmacist and they fill your prescription. We are so much more than that. We are expansive. Pharmacy is one of the most dynamic careers that you can think about. I'm not talking about profession. Like, there's a big difference between profession and a career. And so when you think about pharmacists being in, policymakers, pharmacists who are regulators, there are those who are in academia, those who are in manufacturing, distribution. Like community pharmacy is one of the lowest hanging fruit. It is just a quick way for pharmacists to make money. And if you know anything about pharmacy school and pursuing a pharmacy degree, you'll understand that when we leave school and we don't have rich mamas and rich papas and rich aunties and uncles, we're leaving school with a mountain of student debt. Like when I finished school in Jamaica, my student loan bill was $3,025,000, which is approximately like 30,000 Canadian dollars. And you could be working for a very long time before you make that money back. So it's really a good investment. However, community is just the tip of the iceberg. It is not the end all be all. I remember back in 2009 when I got interviewed for pharmacy school. I remember that Dr. Shelley was one of the persons interviewing me. I believe it was a panel. I can't remember who was on the panel, but I remember Dr. Shelley. And she asked me, like, why do you want to become a pharmacist? And I was so convicted then. I said to her, I want to change the perception about what pharmacists do, and I want to change the brown bagging culture. So basically, brown bagging is the pharmacist just handing the patient the pill in the brown bag. But we do so much more than that. We're connectors. We are we console people. People come to us with their businesses and we keep it private and confidential. But a lot of patients trust their pharmacists more than they trust their doctors. And that's an undisputed fact, because they'll come and tell us things that they don't tell their physicians. And it alters the way we practice, and it also increases the level of care that we're able to provide, because now we're strategically positioned where we can make meaningful interventions. So the next time you see a pharmacist, remember we're dynamic. Remember we're doing the things and all the things. And right now, with the direction that pharmacy is taking in Canada, Alberta already has the widest scope of pharmacist practice globally, not just in Canada, like anywhere in the world. If there's a clinical service that a pharmacist can offer, it is offered in Alberta. And I'm so fortunate and so privileged to have been licensed in that province since, like in 2020, I got an intern license, but licensed as a pharmacist since 2021. It is such a privilege. And to see now, they've been prescribing rather since 2007. Pharmacists in Alberta have been prescribing since 2007, which means Ontario is 17 years behind in terms of an integrative approach, in terms of having a comprehensive health system here where pharmacists can utilize their skills, their knowledge, their expertise to provide care for patients. So now Ontario has again expanded the scope of practice for pharmacists here with an additional 14 minor ailments that we can prescribe for. No, you've worked so hard for that license. You have all this knowledge, like the things we had to learn in all those courses. And imagine you have all that knowledge and you never use it. Eventually you lose it, right? If you have it and you don't use it, you lose it. That's one of the laws of, like, the brain tracks are still there. It is easier for you to recall something that you already knew. But the fact is that if you have it and you don't use it, over time you lose it, and then you'll have to go and do the research and the groundwork and all of that. The point I'm making here is that we are not just dispensers. Our career is dynamic and we don't shout it out enough from the rooftop. And so if we do not set the precedence, if we do not teach people how to treat us and tell them exactly what we do, then we are leaving them to make assumptions. And that's what many people do. So when I had this call with this pharmacist who want to do nuclear pharmacy and, go into oncology research, I was very intrigued. I'm like, kudos to you, because I definitely do not want to stay anywhere near any radiation. Anything that has to do with nuclear, count me out. At least until after I've expanded my family, right? But pharmacists going into nuclear pharmacy is uber cool. Like, I admire that person just for saying, this is what I want, and actually knowing that this is what they want even before setting foot in Canada. So again, we have to set the precedence. We have to tell people what it is that we do, what it is that we want them to know about us. Because if we don't, then they will make their own assumptions. And we can't blame people for that. So I'm excited for pharmacists in Ontario who now have a wider scope of practice. I'm excited for my international pharmacist colleagues who will be benefiting from that sort of system and being able to leverage their license, leverage their knowledge, their skills, their experience, give off their time and talent, and hopefully they will be bold enough to be asked to be compensated or remunerated properly, right? So we're in exciting times. All the international pharmacists that I've met, like when they tell me about their hopes and their dreams and their aspirations, it gets me excited. I'm happy for them. And I'm here to support them in getting to that dream. And we'll see where this goes. But this pharmacist who wants to go into nuclear pharmacy and oncology research, I'm here for it. I'm really here for it. When I tell them I wanted to change the perception of brown bagging, I wasn't lying. But again, I went into pharmacy for one, not because it was something I've always wanted to do, but one, it was a way to escape poverty. For me, it was my stepping stone. It was something that I could leverage. But what really, really inspired me to take on this path was the example that was set by my friend. She's the consummate professional. Like, the way she dealt with patients, I was so inspired. I wanted to emulate that. I was like, oh, so this is what pharmacy is all about. Little did I know that was just the tip of the iceberg, but that really inspired me. And so that's why I was like, I'm definitely going to pharmacy school. So if you're an international pharmacist, or if you know an international pharmacist who's interested in migrating abroad to Canada, where they can leverage their licenses, where they can use their skills and their experience and their knowledge to turn that knowledge into profits, please send them my way. I'll take care of them. They have so much to learn, so much networking to do. But they have so much to offer, and they'll be able to hopefully use the position that they have, leverage it so that they can take care of themselves and their families, which is ultimately what most people are working for anyway, right? So that was my little rant. Thank you, guys. Thank you for the international pharmacists who came on my call and started talking about their dreams about being a nuclear pharmacist. That's really, really, really inspiring. And yeah, I'm gonna be doing another masterclass in another 2 weeks. So I'm looking forward to seeing you guys join us. Stay tuned for information and I'll be sharing more. All right. Y'all have a blessed Saturday. Enjoy what's left of your weekend. And we'll talk again soon. Bye. Thanks for joining, guys.